Hello, everybody. My name is Ryan Averett. I'm a licensed clinical social worker and a mental health therapist. And today, I wanted to talk about Carl Rogers and his contributions to the field of psychotherapy. There's been many very influential figures in the field of psychotherapy since its origin, but I believe that Carl Rogers is amongst the most important. If I had to make a list of the most influential therapists on how I do therapy, Carl Rogers would be at the top of that list. I really believe in a lot of his ideas, and I wanted to talk about how he sort of radically changed the field. I think a lot of people underestimate how much of an impact that he had. And, we learn about all these theories, we sort of hear about how therapy has evolved over time, but maybe we don't always necessarily give Carl Rogers the credit that he's due. So I want to talk about Rogers and how he changed therapy. How Carl Rogers changed therapy. To answer this question, we're going to answer a couple sub-questions, and these are kind of going to be like the chapters of the video. So we'll talk about what was therapy like before Rogers, what did Carl Rogers believe, and how has therapy changed since Rogers. First, what was therapy like before Rogers? To answer this question, we'll dig into some sub-questions. So we'll talk about before Rogers, what was the general goal of therapy, what was the approach of therapy, what was the therapist's role, and what was the client's role. Before Rogers, the main goal of therapy in the 1900s was often to reduce or eliminate symptoms by uncovering hidden, unconscious conflicts. Freud and his followers believed that problems stemmed from repressed drives, childhood traumas, or unresolved inner conflicts, and therapy aimed to make these unconscious forces conscious so that the client could gain insight and symptom relief. What was the approach? Well, like we talked about with Freud, the field was very much psychoanalysis dominated. So treatment looked like long-term, highly structured, multiple sessions a week. What would happen is the clients would often recline on a couch while the analyst sat out of sight, and the therapist would take an interpretive stance. So the therapist analyzed the client's dreams, slips of the tongue, resistance, and transference. And there was even a lot of directive methods in other traditions. So even outside psychoanalysis, therapists often gave advice, assigned solutions, or prescribed how clients, quote-unquote, should behave. What was the therapist's role here? The therapist was seen as an expert. They had specialized knowledge that the client lacked. Their job was to diagnose, interpret, and explain the client's behaviors and thoughts, often in ways that the client could not see themselves. And the therapist was authoritative, sometimes even distant, deliberately avoiding showing personal emotion to maintain a state of neutrality. And what was the client's role? The client was viewed as relatively passive. Their job was to report their dreams, free associate, answer questions, and provide material for the therapist's analysis. Clients weren't really expected to guide therapy or set goals. They were more like subjects of treatment. And change was assumed to come through the therapist's expertise, not the client's own resources. This is a very rough and short summary of what therapy was like before Rogers, and at some point I want to do a video talking about Freud and his beliefs and how he impacted the field, but this is a rough overview so we can get a kind of idea of the changes that happened because of Carl Rogers. So, what did Carl Rogers believe? We're going to talk about Carl Rogers in terms of a paper that he released called The Necessary and Sufficient Conditions of Therapeutic Personality Change. There's a lot you can read about Rogers, there's many resources, but I believe that this paper puts his ideas sort of well in a handful of pages so that anyone could read it and get across his general thoughts on things. At the beginning of the paper, he identifies the problem. Is it possible to state in terms which are clearly definable and measurable the psychological conditions which are both necessary and sufficient to bring about constructive personality change? It's a loaded question. He defines constructive personality change as change in the personality structure of the individual at both the surface and deeper levels, in a direction which clinicians would agree means greater integration, less internal conflict, and more energy utilizable for effective living. And then he outlined these conditions. And we're going to talk about each of these and dig into them, but this is the general idea of what Carl Rogers believes is important for therapy. These are the necessary and sufficient conditions for therapeutic personality change. So I'll read through them real quick and then we'll dig into each one. Number 1, 2 persons are in psychological contact. Number 2, the first, whom we shall call the client, is in a state of incongruence, being vulnerable or anxious. 3, The second person, whom we shall term the therapist, is congruent or integrated in the relationship. 4. The therapist experiences unconditional positive regard for the client. 5. The therapist experiences an empathetic understanding of the client's internal frame of reference and endeavors to communicate this experience to the client. And 6. The communication to the client of the therapist's empathetic understanding and unconditional positive regard is to a minimal degree achieved. Carl Rogers said no other conditions are necessary. If these 6 conditions exist and continue over a period of time, this is sufficient. The process of constructive personality change will follow. You may have noticed already that this is very different than what came before. There's no you lie on the couch and I analyze your dreams. There's no we try to figure out what your transference means for you. There's no let's dig out what's in your unconscious and make it conscious. It's just these 6 conditions. This is essentially all Carl Rogers believed was important, which is a pretty radical change from what came before. So, these are confusing. These have a lot of specific words. Let's dig into what each of these mean. Here's the first condition. 2 persons are in psychological contact. And there's a lot of quotes here that I'll use throughout this. Anytime that there's a quote, assume it's from Carl Rogers. He says the first condition specifies that a minimal relationship, a psychological contact, must exist. I'm hypothesizing that significant positive personality change does not occur except in a relationship. Again, this is very different than the ideas that came before. He says all that's intended by this first condition is to specify that 2 people are to some degree in contact, that each makes some perceived difference in the experiential field of the other. This first condition of therapeutic change is such a simple one that perhaps it should be labeled as an assumption or a precondition in order to set it apart from those that follow. So there's 6 conditions. It seems like this is, not that it's not important, but it's sort of just a qualifier. 2 people are in psychological contact. I'm not going to elaborate too much on this, other than to say that this, what's right here. I'm hypothesizing that significant personality change does not occur except in a relationship. Even today, that's kind of a radical idea. Like, you could have this idea that, I could do my own work. I could reflect on myself, by myself, and make positive personality change. And at least according to Rogers, he does not think that positive personality change will occur if you're just doing it by yourself. He believes that a relationship is important to this. That's kind of all I have to say about this one for now. Let's jump into the second one. He says the first, whom we shall term the client, is in a state of incongruence, being vulnerable or anxious. He defines incongruence as a discrepancy between the actual experience of the organism and the self-picture of the individual insofar as it represents that experience. He says if the individual dimly perceives such an incongruence in himself, then a tension state occurs, which is known as anxiety. So that's kind of how he defines what anxiety is, a perceived incongruence within the self. He says such anxiety is often seen in therapy as the individual approaches awareness of some element of his experience, which is in sharp contradiction to his self-concept. Now, this is kind of wordy and a little bit confusing, and there's a lot of terms here. What does all this mean? I want to go through some examples. Well, first of all, you can see the picture on the right side, which I believe makes it a little bit more clear. He has this idea that incongruence is whenever your ideal self and your perceived self are at a discrepancy. They're sort of ripped apart from each other. And if we can make these align or overlap, the ideal self and the perceived self, then there would be a state of congruence. And this is kind of at the basis of what Carl Rogers believes that we're doing in therapy. We're trying to increase congruence, decrease incongruence. But again, it's kind of wordy. What do these things mean? Some examples. You might imagine a parent, and they have their perceived self, which is sort of just the reality of what's going on with them. They say, well, I lose patience with my kids sometimes. And their ideal self says, well, a good parent should always stay calm and understanding. So because of that, there's a discrepancy there. Perceived self, I lose patience with my kids. Ideal self, a good parent should always be calm and understanding. So there's an incongruence here, right? When they get upset with their kid, they feel like a bad parent, and this increases guilt and internal conflict. Another quick example, you might imagine a student, and they have their perceived self. I'm a hardworking student, but I do struggle with math sometimes. And then they have their ideal self. I should be smart enough to ace every single subject. So again, there's a discrepancy there. Whenever they get a poor math grade, they start to feel anxious and ashamed, not just disappointed, because their perceived self does not match their ideal self. There's that discrepancy, so there's, as Carl Rogers would say, incongruence. That's sort of a simple explanation of a lot of wordy concepts in there in those quotes. But again, this is kind of at the basis of what Carl Rogers believed what was going on with people in a negative way. There's all sorts of different words that different therapists would use, like Freud would use the word neuroses going on with people. Carl Jung would say that people have complexes, right? There's different ways that different therapists frame problems going on with people. And Carl Rogers' framing of problems was this idea of incongruence and congruence. So, this second condition is basically just saying the first, who we shall term the client, is in a state of incongruence, being vulnerable or anxious. So what we have so far, two persons are in psychological contact, and the client is in a state of incongruence. What's the third condition? A second person, who we shall term the therapist, is congruent or integrated in the relationship. So this goes back to the concept we just talked about, congruence. The third condition, and this is Carl Rogers' quotes again, the third condition is that the therapist should be, within the confines of this relationship, a congruent, genuine, integrated person. It means that within the relationship, he's freely and deeply himself, with his actual experience accurately represented by his awareness of himself. It's the opposite of presenting a facade, either knowingly or unknowingly. He says it should be clear that this includes being himself even in ways which are not regarded as ideal for psychotherapy. His experience may be, I'm afraid of this client, or my attention is so focused on my own problems that I can scarcely listen to him. And if the therapist is not denying these feelings to awareness, but is able to freely be them, be his feelings, as well as being his other feelings, then the condition we have stated is met. So, what do we have so far? Again, recap. Two persons are in contact. The first, the client, is in a state of incongruence. The third, the clinician or the therapist, is integrated or congruent. And I wanted to pull another quote too, because I think this one sort of gets the idea across even better. This quote is not from the paper that we've been quoting this whole time, but it's a very popular Carl Rogers quote and gets the point across. He says, I find I am more effective when I can listen acceptantly to myself and I can be myself. I feel that over the years I have learned to become more adequate in listening to myself so that I know, somewhat more adequately than I used to, what I am feeling at any given moment. To be able to realize I am angry, or that I do feel rejecting towards this person, or that I feel very full of warmth and affection towards this individual, or that I'm bored and uninterested in what's going on, or that I'm eager to understand this individual, or that I am anxious and fearful in my relationship to this person. All of these diverse attitudes or feelings which I think I can listen to in myself. One way of putting this is that I feel I have become more adequate and letting myself be what I am. It becomes easier for me to accept myself as a decidedly imperfect person, who by no means functions at all times in the way in which I would like to function. Sorry, I have to stop there for a second because, some of the way Carl Rogers speaks is very, very poetic, and he basically has this idea, look, if you're going to be a therapist, if you're going to be a good therapist, you have to be congruent. You sort of have to be true to yourself. You have to sort of accept your emotions as who you are in the relationship. And a lot of times, like he says this is not always regarded as ideal for psychotherapy, right? Like sometimes that's going to be negative feelings, like I'm afraid of this client, or I'm so focused on my own problems I can't listen to him, right? Like, and the therapist has to actually be those feelings and be in alignment with those. I couldn't find this quote, but I've always heard this story about Carl Rogers sort of feeling bored in a therapy session. And he, you might imagine if you're a therapist that, well, if you're bored, like, you wouldn't want the client to know that. You should put up this facade that you're very interested. Even if you don't really care about what's going on, you're not very interested, but you should still act interested. And Carl Rogers would say, like, no, like, if you're feeling a certain way, not that you should be rude about it or, excessively difficult about it, but you should acknowledge your emotions. Like, I'm feeling bored in this moment. So anyway, I couldn't find this quote, or the story, but the story was kind of the idea that Carl Rogers said this in a session. He said, I noticed that I'm kind of feeling bored right now. Do you think other people feel bored when they talk to you? And that might sound kind of jarring. You might say, well, no, a therapist should never say something like that. But if the clinician isn't being real with themselves, like, it's sort of like, what's the point? At least that's what Carl Rogers believed. So here's the third condition. The therapist is congruent or integrated in the relationship. Another way of putting this, sort of in my own words, is the therapist is being genuine. So that's the third condition. The therapist is genuine or congruent. The fourth condition. The therapist experiences unconditional positive regard for the client. He says, to the extent that the therapist finds himself experiencing a warm acceptance of each aspect of the client's experience as being a part of that client, he is experiencing unconditional positive regard. It means that there are no conditions of acceptance, no feeling of, I like you only if you are this, thus or so. It means a prizing of the person. It involves as much feeling and acceptance for the client's expression of negative, bad, painful, fearful, defensive, or abnormal feelings as for the expression of good, positive, mature, confident, social feelings. It means caring for the client, but not in a possessive way or in such a way as simply to satisfy the therapist's own needs. It means caring for the client as a separate person with permission to have his own feelings and his own experiences. Again, very sort of poetic way of putting it, but basically, we have a warm acceptance of the client, right? There's not ongoing judgment towards the person. It's, I accept you for who you are. You are your own separate individual person, and I fully accept that. A lot of our day-to-day relationships are conditional in many ways. I really like my friend, but if they were to do this horrible thing, then I'd probably stop being their friend. That's not what's going on here. It's a full acceptance of the person. All of the good, all of the bad, we accept it. This unconditional positive regard. There's a whole lot more I could say. There's whole lectures on what unconditional positive regard means and looks like. But again, we only have so much time. This is a rough summary of what it means in Carl Rogers' own words. And he puts it very well. So here's the fourth condition. The therapist experiences unconditional positive regard for the client. Fifth condition. The therapist experiences empathetic understanding of the client's internal frame of reference and endeavors to communicate this experience to the client. He says the fifth condition is that the therapist is experiencing an accurate, empathetic understanding of the client's awareness of his own experience. To sense the client's private world as if it were your own, but without ever losing the as-if quality. This is empathy, and this seems essential to therapy. To sense the client's anger, fear, or confusion as if it were your own, yet without your own anger, fear, or confusion getting bound up in it. It's the condition we are endeavoring to describe. When the client's world is this clear to the therapist, and he moves about in it freely, then he can both communicate his understanding of what is clearly known to the client and can also voice meanings in the client's experience of which the client is scarcely aware. To sum it up in one word, empathy. The clinician has empathy and tries to communicate this experience to the client. So maybe the client's describing a situation and the clinician was like, oh my goodness, that must have been horrible. Like, you must have felt so angry. Like, I feel like I would feel so angry in that situation. How did you feel? Like, digging into the emotions and trying to feel the emotions with the client to the best of the clinician's ability. That's the fifth condition. And the final condition, the communication to the client of the therapist's empathetic understanding and unconditional positive regard is to a minimal degree achieved. So basically looking at those last conditions, the empathetic understanding, unconditional positive regard, these are communicated to the client, and the client seems to accept that communication. He says the final condition is stated that the client perceives, to a minimal degree, the acceptance and empathy which the therapist experiences for him. Unless some communication of these attitudes has been achieved, then such attitudes do not exist in the relationship as far as the client is concerned, and the therapeutic process could not, by our own hypothesis, be initiated. Since attitudes cannot be directly perceived, it might be somewhat more accurate to state that the therapist's behaviors and words are perceived by the client as meaning that to some degree the therapist accepts and understands him. So there's a part there where he basically says, look, the client isn't going to be a mind reader. You sort of have to express these feelings and thoughts, and communication is to a minimal degree achieved. So this empathy and unconditional positive regard is communicated, and the client receives it. And those are the conditions. That's essentially all that Carl Rogers believed was necessary and sufficient for therapeutic personality change. Which again, it's very radical to what came before, right? There was a lot of conditions on what was necessary before, and Carl Rogers didn't necessarily believe that those things mattered. And it's pointed out here in this slide, like there's significant things that Carl Rogers omitted from his 6 conditions that he didn't believe were important. He says, if there's any startling feature in the formulation which has been given as to the necessary conditions for therapy, it probably lies in the elements that were omitted. For example, it's not stated that these conditions apply to one type of client, and that the other conditions are necessary to bring about psychotherapeutic change with other types of clients. So, there would be multiple forms of therapy for somebody who has generalized anxiety disorder, major depressive disorder, post-traumatic stress disorder, borderline personality disorder. And prior to Rogers, the idea was, well, you need these very specific treatments for very different types of people. And Rogers is saying, no, you don't need that. You just need the 6 conditions. He says it's not stated that psychotherapy is any special kind of relationship, different from all others which occur in everyday life. This is another kind of very interesting idea. He's essentially saying that there's nothing super special about the therapy relationship. If these conditions can happen in other relationships, then they can lead to therapeutic personality change. And, sometimes when I work with a client and we have a specific time frame, one thing that I try to do, especially towards the end, a lot of people I might see because they're depressed. And a lot of times people who are depressed start to isolate a lot. So their capacity to have relationships with others goes down. Or at least their willingness to engage in relationships with others goes down. And a lot of times if I know treatment's about to end, one thing I'll emphasize is social interaction. Look, we're not going to be meeting forever. I can't give you these positive conditions for that much longer. So you're going to need good people in your life that care about you and want to sort of offer some of these conditions to you. You can have, a lot of times people have a really great relationship in therapy and sort of say, well, this is extremely unique. And, once I lose this, I'm never going to have a relationship like this again. And it's like, no. You can have all of these same conditions in outside relationships. They might, they might decrease and increase in some ways. Like I said earlier, there's some friendships that are conditional in some ways, and maybe that's worth pointing out. But to the degree that you can have these conditions in a friendship or in a romantic relationship, therapeutic personality change can happen. Essentially, Rogers is saying, I'll just say it in his own words. It's not stated that psychotherapy is a special kind of relationship. Another thing that's an omission that Carl Rogers said is it's not stated that special intellectual professional knowledge, psychological, psychiatric, medical, or religious, is required of the therapist. Saying you don't need to be super well versed in this specific thing. You don't have to be a doctor. You don't have to be a pastor, right? As long as you have these 6 conditions, you're good. Therapeutic personality change can occur. And he says it's not stated that it's necessary for the therapist to have an accurate psychological diagnosis of the client. Again, this is very different than what came before. He's kind of saying that an accurate diagnosis doesn't really matter, right? As long as these conditions exist, therapeutic personality change will occur. So this kind of points out all of the ways in which Carl Rogers' ideas were somewhat radical for the time that he was in, but even for the times now, a lot of treatment nowadays says, okay, you have to have this very specific diagnosis. We have to make sure that this diagnosis is highly accurate, and we have to make sure that the treatment is the most effective treatment for this specific diagnosis. And Carl Rogers is saying, no, we can introduce this person-centered approach, these necessary and sufficient conditions, and it doesn't really matter if your diagnosis is super accurate. Therapeutic personality change will still happen. Now, I want to go off and read something. This is from one of Carl Rogers' books called On Becoming a Person. This is from his chapter 5. What we know about psychotherapy, objectively and subjectively. And this section that I'm going to read describes the client's subjective experience about therapy. It's a little bit long, but again, Carl Rogers has a very poetic way of speaking sometimes, and to be quite honest, I find this section of his book really beautiful and interesting, so I want to read through it really quickly. So this is, again, Carl Rogers describing the client's experience of therapy. And obviously not every client is going to have this exact experience, is going to word their thoughts in the exact same way, but this is sort of how he thought people would change over the course of his type of treatment. So I'm going to start, this is all sort of Carl Rogers' ideas of quotes from the client. So I'll start here. So this is, again, kind of the start of therapy. I'm afraid of him. I want help, but I don't know whether to trust him. He might see things which I don't know in myself, frightening and bad elements. He seems not to be judging me, but I'm sure he is. I can't tell him what really concerns me, but I can tell him about some past experiences which are related to my concern. And he seems to understand those, so I can reveal a bit more of myself. But now that I've shared with him some of this bad side of me, he despises me. I'm sure of it. But it's strange I can find little evidence of it. Do you suppose that what I've told him isn't so bad? Is it possible that I need not be ashamed of what is a part of me? I no longer feel that he despises me. It makes me feel that I want to go further, exploring me, perhaps expressing more of myself. I find him sort of a companion as I do this. He seems really to understand. But now I'm getting frightened again, and this time deeply frightened. I didn't realize that exploring the unknown recesses of myself would make me feel things I've never experienced before. It's very strange because in one way these aren't new feelings, since they've always been there. But they seem so bad and disturbing I've never dared to let them flow in me. And now as I live these feelings in the hours with him, I feel terribly shaky, as though the world is falling apart. It used to be sure and firm, now it's loose, permeable and vulnerable. It isn't pleasant to feel things that I've always been frightened of before. It's his fault. Yet, curiously, I'm eager to see him, and I feel more safe when I'm with him. I don't know who I am anymore, but sometimes when I feel things, I seem solid and real for a moment. I'm troubled by the contradictions I find in myself. I act one way and feel another. I think one thing and feel another. It's very disconcerting. It's also sometimes adventurous and exhilarating to be trying to discover who I am. Sometimes I catch myself feeling that perhaps the person I am is worth being, whatever that means. I'm beginning to find it very satisfying, though often painful, to share just what it is I'm feeling at this moment. You know, it's really helpful to try to listen to myself, to hear what's going on in me. I'm not so frightened anymore of what's going on in me. It seems pretty trustworthy. I use some of my hours with him to dig deep into myself, to know what I am feeling. It's scary work, but I want to know. And I do trust him most of the time, and that helps. I feel pretty vulnerable and raw, but I know he doesn't want to hurt me, and I even believe he cares. It occurs to me, as I try and let myself down and down deep into myself, that maybe if I could sense what is going on in me and could realize its meaning, I would know who I am. And I would know what to do. At least I feel this knowing sometimes with him. I can even tell him how I'm feeling toward him at any given moment, and instead of this killing the relationship as I used to fear, it seems to deepen it. Do you suppose I could be my feelings with other people too? Perhaps that wouldn't be too dangerous either. You know, I feel as if I'm floating along on the current of life, very adventurously being me. I get defeated sometimes, I get hurt sometimes, but I'm learning that those experiences are not fatal. I don't know exactly who I am, but I can feel my reactions at any given moment, and they seem to work out pretty well as a basis for my behavior from moment to moment. Maybe this is what it means to be me. But of course, I can only do this because I feel safe in the relationship with my therapist. Or could I be myself outside of the relationship? I wonder. Perhaps I could. Now that's it. That's the quote. I find that sort of fascinating for this whole idea of what Carl Rogers believed. And it's very poetic, as you can kind of see. If you're at all interested in learning any more about this, I'd encourage you to read Carl Rogers' book on becoming a person. I went online and sort of heard some people talking about it, and some people said it was very dry, and that's not my experience with it at all. I think if you're a clinician and you've had therapy with people ever before, as you read it, you'll start to see elements of what you've experienced before start popping out of the page. At least that's what I experienced doing a sort of client-centered therapy with people and reading the book afterwards. Now, how has therapy changed since Rogers? He's had a significant impact on the field. After he kind of came onto the scene, there was this humanistic expansion in the 1950s and 60s. Rogers directly inspired person-centered therapy, Gestalt, existential therapy, and all of these focus on authenticity, presence, and human growth. Afterwards, you could sort of view his contributions as more of integrations into other models. So even with approaches like CBT, which focus heavily on thoughts and behaviors, these approaches began emphasizing the therapeutic relationship as a foundation. So, you might look at that as a lot of people who are doing something like CBT today. They might be very focused on cognitive restructuring, behavioral activation, exposure therapies, but all of them sort of have the idea that, well, at the basis of it, you have to have Carl Rogers principles. You have to be empathetic, non-judgmental, congruent. This has sort of been absorbed into all other forms of popular therapy. And, even here, contemporary therapy. Across modalities, research shows that the alliance, the empathy, the warmth, the congruence predicts outcomes better than specific techniques. So Rogers' core ideas have now become common ground. And you can see this in the thematic shifts of therapy as well. So we've sort of gone from this idea of just pathology to growth. Therapy is no longer about just symptom relief, but it's also about flourishing, resilience, and what Carl Rogers would call self-actualization. Therapy has also gone from expert to collaborator. So the therapist is now a guide or partner and is not seen as strictly an authority, handing down their wisdom, handing down their interpretation to the client. And there's been a thematic shift from techniques to relationship. So evidence supports the idea that the alliance is the sort of active ingredient across all therapies. There's specific treatment approaches with different, there's CBT and the specific parts of CBT. There's DBT and the specific parts of DBT. But like I said, some of those techniques don't appear to work very well whenever you research them if there aren't these active components, the congruence, the unconditional positive regard, right? These types of things may be what's more contributing to the effectiveness of therapy than these specific treatment modalities. Now, this is pretty much it. This is all I had to say on the topic. I could say more, but it looks like we're around 30 minutes in already, which I did not expect this video to go this long. I really wanted to talk about this because I really, really like Rogers as a therapist. Like we kind of covered at the end of there, I think many different forms of therapy have absorbed his major principles, and I think we don't always recognize that, right? Maybe it's because we don't all have time machines. We can't all go back 100 years and actually see what psychoanalysis sessions were like. But I think many people who would describe themselves as, oh, well, I'm a CBT therapist, or I'm a DBT therapist, or, this or that. Oftentimes at their core, they're a client-centered therapist or a Rogerian therapist, right? So I think sometimes we lose sight of that, right? Sort of identifying with these specific labels, these specific treatments. We lose sight of the fact that Carl Rogers' ideas significantly impacted the field. I'll also say this, too, at the end. Carl Rogers believed that these 6 conditions were necessary and sufficient. I'm not entirely sure of that all the time. There may be cases where additional things are needed, and there might be limitations to what Carl Rogers said. And, fair enough, we can point that out, we can identify that in the research. I don't just do client-centered therapy and nothing else, right? There's reasons why we tack on extra things. And Carl Rogers is not a god. He had some great ideas. I really appreciate his ideas, and I've adopted his ideas. But it's not gospel. and there's plenty of limitations to his ideas, so I want to recognize that too. But overall, I think he's a phenomenal therapist. I think if you're a therapist and you start reading Rogers, that will become apparent very, very quickly if you haven't already read Rogers. And I really enjoy Rogers, so I wanted to spend some time talking about him. I hope for some people this was either educational, informational, or entertaining in some kind of way. But I appreciate anyone who got to this point watching the video. That's all I've got today. You have a great rest of your day. Take care.